week, we continue to highlight our career and technology education programs in Robinson ISD with our health sciences. So you'll hear from Courtney Baugh and some students about the things that they learn in those courses. Also, on behalf of HOSA, that student organization, we invite you and the community to join us on February 25th for our next Carter blood drive.
Hi, I'm Courtney Baugh, and I'm the teacher for our health science pathway. In this pathway, the students will start off with the principles of health science class, which kind of teaches them some of the basics of the hospital. We talk about communicating with patients, communicating with coworkers, so they learn a lot of communication skills and learn how to be patient. We talk about insurance, and we cover many of the careers in healthcare so that they learn more about just the nurses and doctors, that there's also biomedical technology and research, and some people behind the scenes that you forget about, and a lot of the clerical stuff too. And then they step up to the medical terminology, which is just learning all of the different parts of the medical words so that they can define those medical words and understand those medical records when they get out into the field. And then the anatomy and physiology is another part of that, where they learn all about the body and the functions of the body. Then we move on to health science clinical. This one allows the kids to get a certification as a medical assistant, how to do insurance, how to code, for different exams, so taking those vital signs, bringing the patient back, getting the patient's history, finding out what their initial problem is, and get all the information for the doctor to come in. So we learn a little bit about understanding EKGs for the patient so that they are prepared to take their certification exam and be certified before they leave high school. In the classes, the kids are actually able to physically do some hands-on skills. We have these great hospital beds and the dummies that the students are able to use as their patients. We actually have the stethoscopes and the blood pressure cuffs and things so they can physically do these skills hands-on, and it's not just talking about the skills. So there's just a lot of hands-on components where they have to go in, introduce themselves, provide that privacy, position the patient properly. Those skills that are actually going to help them out in the field and not just reading about them in a book.
This class is health clinical, and we utilize our skills for outside jobs such as a CMA, and right now we're learning about taking vital signs and how to communicate with the patient and the physicians.
I've been in Ms. Ball's classes. I've been in MedTerm, Principles of Health Science, and Health Science Theory. And what Health Science Theory does is that it actually helps you become a CMA. So it can help you inside of the career to be in the medical field. It's like a big step in the door. Sophomore year, and I was in Principles of Health Science. What that did is that it helped us understand like anything that goes on in the medical field, like paperwork, communication skills, just stuff like that. Like, I understand insurance now, so that's pretty cool. I really do like this class because it really helps you understand what's going on in the medical field, because there is a lot going on. And sometimes it's really hard to understand, but Ms. Baugh really does help with, all the work.
So I am a part of many healthcare organizations right now, an organization called HOSA, which stands for Health Occupation Students of America. And with this, we can compete in different competitions, varying from professional speaking to making a poster on a certain disease and medical photography. We actually have a competition coming up next weekend, which we are very excited for. We also do very many volunteer events to where we can help our community.